On today's World Insight, alarm over a second COVID-19 wave, the preventive measures taken as the US and Europe struggle with a rise in confirmed cases. And the sounds of old Beijing life kept alive in a museum. Why they matter, in the words of a Chinese-British artist.
They mean a lot to us now here in China.
Here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei in Beijing. We begin today's program with the latest on COVID-19. New cases were reported in China's northern province of Shandong. The province's biggest city, Qingdao, posted 6 confirmed cases and another 6 asymptomatic carriers over the weekend. The city of about 9 million people plans to carry out coronavirus tests on all residents within 5 days. Worldwide, the number of confirmed cases is approaching 38 million. In Europe and the US, many medical experts are sounding the alarm over a second wave of infections. For the latest situation related to COVID-19, we are joined by a strong panel in Providence, Dr. Megan Rani, emergency physician with Brown University. In Seoul, Dr. Alice Qingdao, internist at Ms. Medi Women's Hospital. And in New Haven, we invited Xi Chen, associate professor of health policy and economics at Yale School of Public Health. Welcome to the three of you. The situations are not necessarily getting better, but rather getting very challenging. Dr. Rani, I want to begin with the United States. According to the latest report, it is suggesting that for every 2 Americans that have lost their lives in COVID-19, there's actually another one that is underreported. How do you see reports like this? Should we rely on these reports, or should we rely on the so-called official data?
It's a really difficult question to answer right now, Tian. We certainly fear that we are undercounting and underreporting COVID-19 across the country. As you know, we still lack adequate testing, particularly for some of our more vulnerable populations, as well as for folks in rural areas. And the diagnoses of COVID-19 after death, of course, require our coroners and medical examiners to do the testing and make the accurate diagnosis. Unfortunately, many of our medical examiner and coroners offices are overwhelmed and underfunded. So it's really difficult to know how true that report is. But what we do know, without a doubt, is that we are certainly undercounting the impact of this virus on the health of Americans.
Meanwhile, we have seen, Dr. Qingdao, a situation around different parts of the world that's not necessarily encouraging. For example, in Europe, I know you are based in South Korea, but I also know that you have been following the picture worldwide. How should we understand the dramatic increase of numbers in Europe, in the UK, in Spain, in Italy, in Slovakia, and even some of the countries that used to not necessarily high on the list of deaths or infections?
I think what we're seeing is rebound after they loosened their social distancing and lockdown measures for the summer holidays. People were tired. They were very eager to go and travel, to eat in restaurants, to sort of resume normal life. But COVID-19 was not permissive, basically, in terms of letting people have their normal lives and having COVID-19 under control. And so right now what we're seeing is a rebound in cases, places like the UK, the Netherlands. The number of daily new cases is soaring, and I think the UK they're looking at lockdown again.
Yeah.
Here in Korea, we've sort of resorted to finding ways of living with COVID-19 in our daily lives, and so that's our policy is social distancing in daily life. We have accepted that COVID-19 is not going to go away, and so that's been our policy, is to try to find ways to sustainably keep our society moving while keeping the virus suppressed.
Yeah, I also understand in some of the other Asian countries, countries are also fighting on a daily basis, and the picture is not necessarily that promising. Dr. Chen, you're based in the United States, but at the same time, I'm sure you also look at China's number. For the very first time in 56 days, China has had several cases, 6 mainly confirmed cases in Qingdao, a ski resort city of 9 million people, and also 6 asymptomatic cases in the same city. Now they're talking about a whole city testing of 9 million. Tell me about your response to the latest news from China.
The patient was coming from abroad, and he or she was receiving the care and the CT scans in the hospital, but without proper measures to avoid infection, and that was brought to larger number of cases, now double digits. But still, it's a flare up. It's imported case without a vaccine, so we need to stick to the non-pharmaceutical interventions, meaning the large-scale testing, contact tracing, isolation. So I think the testing of the city would be helpful, because this is based on large-scale testing, and the testing will give us the number of the positivity rate, which is very important, because that will guide us where the epidemic is and how severe the issue is.
9 million people, that's the population of Qingdao. Now the government has vowed to do the testing of every one of them within 5 days. We're already into the into the second day of the 5 days. And meanwhile, we also know about 4.5 million people traveled to Qingdao during the National Day holiday. Now, how is that going to have an impact on the overall picture for China's prevention and control COVID-19? It's a big question mark. When I'm saying this, I'm sure Dr. Rani and even Dr. Qingdao, you are amazed by the fact that China is going to test a city of 9 million because of 12 cases. But that's how China has been doing it, and so far it has been successful. The reason I'm saying this is not about China's so-called record, but rather it's about how we can look at the latest COVID-19 threats and challenge, and how internationally globally can we work together. Now, Dr. Rani, do policy still matter? Now, with the numbers really rising in United States, in some parts of Europe, people are having this fatigue, and some people are having the thoughts of giving up. They would say, why don't we just have, herd immunity? Anyway, I can't live like this anymore. Now, is that a choice? What should be the policymakers' choice or choices?
So I think there are a wide range of choices, and great policies both allow for control of transmission of COVID-19 and at the same time allow people to get back to some semblance of normalcy. So with policies like universal masking or keeping indoor restaurants at maybe 25% capacity, you can minimize the spread of COVID-19, but still allow people to go back to work, allow children to go back to school. It doesn't have to be an either or. And I think that I and any other behavioral scientist, again, I'm an emergency physician, but I'm also a public health researcher, any of us would say that we know from a behavior change standpoint that those types of draconian lockdowns are simply not feasible for most people, certainly not over a long period of time. So if we expect to control COVID-19, we have to do it with a little more nuance and based on the science of behavior change. And great policies will help us do that. Of course, policies alone are never enough. You need to accompany policies by education, by having influencers who give positive messages, and of course by making it really easy to do the right thing. You have to make it easy for people to wear masks. You have to make it easy for people to get tested. And you have to make it easy for people to stay home if they or their children or their parents are feeling sick. And in the societies that are doing a good job of controlling this virus, they're doing all those things, allowing the economy to reopen, while also recognizing that it's really tough to completely eradicate COVID-19 from our society, and that really can't be a realistic goal.
You are based in the United States. You have a presidential election season. And unfortunately, that also coincides with the coming of the winter, which could be a big threat for COVID-19 for the overall population. Now, we all know in the U.S., mask has become a very political issue. You have a president, very unique. Now, he is on the campaign trail already without masks, talking to his supporters, even though the White House doctors suggested that he's been having negative results in the testing for consecutive days. But Dr. Rani, once again, I asked about policy from now until the end of the presidential election season. There's likely to be very different messages in the society, even coming from the administration. So how do you think that's going to work? And as a public health, as you said, expert, what can you do and your colleagues do?
So I do think that we need to recognize that we are unlikely to see any large-scale leadership from our executive branch between now and November 3rd, and possibly not between now and January 20th, whether it's for increased production of personal protective equipment, increased testing, or messaging around masking. At this point, what most of us are focusing on is on the individual states and on our state-level responses. You know, in Rhode Island, our governor has been tremendously effective in putting universal masking protocols and policies in place, in controlling movement of people from high-risk states into ours, in making testing easy to access, and in providing support for businesses that are struggling with current regulations. Our governor's just been stellar. And I think if we can see that across the United States, then we have a hope of controlling this virus despite the impending election and whatever it brings. I don't think that we can just throw up our hands and say that we're not going to try just because we have an election in about a month. Similarly, we can't wait on the national government to act right now.
Our salute definitely to those regional leaders inside the United States who are making the right decision for their peoples. And Dr. Chen, if I could, you heard from Dr. Rani suggesting some practices may be used in China or some of the earlier countries who caught with COVID-19 and then become quite successful in control and prevention would not necessarily now work anymore in the U.S. or in some of the continental Europe. Your take about that, the different ways of dealing with things?
Yeah, so at this stage, it becomes more and more difficult to implement widespread and large-scale lockdown or takedown of those measures. So those measures have to be smart and has to be targeted to those who are most vulnerable and who are most needed those protections. So in the United States, like more than 40% of the population have all kinds of obesity, and diabetes and hypertension. So even in the younger generation, so they are not risk-free. So and even besides that, most recently, this morning, the news from the U.S. study shows that this virus can be reinfecting people, and they identified a clinical case for a person aged 25, and he was contracted 2 different strains of the virus. So when we talk about those strategies, we need to think about whether this is feasible towards a virus. We still don't know quite much about it.
Complicated, that is for sure, isn't it, Dr. Qingdao?
Yes, it is complicated, and so the approach has to be multi-pronged. I completely agree that we need a risk-adaptive approach. We have segments of the population that we know are at highest risk for death and for serious adverse effects. And so how do we target our protective efforts to try to keep them safe? Not just from COVID-19, but from all of the other psychosocial isolation and other sequelae, so to speak, of living with COVID-19, being in a somewhat isolated mode. At the same time, you have to keep the prevalence, the overall prevalence of the virus suppressed in your society. Otherwise, because of the large numbers of asymptomatic carriers, it can spread very easily under the radar. It spreads, it bubbles under the surface. And then all of a sudden, once it gets to a certain threshold, we're not sure exactly what that threshold is, but once it gets to a certain threshold, you see an explosion of cases, and you just cannot have that happen. So it's both a specific targeted approach to certain populations, but also in the general population, you have to make sure that the virus is suppressed. The SARS-CoV-2 virus, COVID-19, is a very tricky disease, and we need to be very creative in trying to find ways around it so that we can get ahead of it and prevent big outbreaks and big situations where a lot of people are dying of the disease. That's the goal, is to prevent morbidity and mortality, to prevent death and also disability due to COVID-19.
Yeah. Now, COVID-19 fatigue, it's not only happening in countries that have been severely hit, for example, the U.S., some of the continental European countries, but also here in China. I'm sure in South Korea too, in Southeast Asian countries as well, because we've been hearing about that, looking at other countries and be careful and not be able to travel beyond borders. All of this are necessary, but when it's a long time practice, it's certainly getting into the socio-economic impact that many of you have been talking about. Having said that, though, what can we do now? There is issues like COVAX, with 171 countries and regions joining in among the vaccines. But we know even with COVAX becoming a total success and having adequate vaccines by the end of this year, early next year, the biggest possibility we have is only 20% of the global population having access to vaccine by the end of 2021, which is far from a natural so-called herd immunity of 70% in order to avoid further deaths and spread of the disease. So we're so far away from there. From now till then, until much later, what can we do together? With the winter coming, many are having this question in mind.
So my first and strongest answer for what we can do is universal mask wearing. And of course, people who are sick stay home. But if everyone is universally masked, you can decrease transmission of the virus by somewhere between 60 and 90%.
Wow.
That's just a tremendous impact on the global burden of disease. So that would be my first thing. The second thing that we can do is to support each other. You've mentioned the psychosocial effects of this disease. They're very real. We certainly have seen anecdotally many folks coming into my emergency department who are feeling more anxious or lonely or sad because of the isolation from COVID-19. And so the second thing is to create those virtual communities or to create the small, stable pods where we can reach out and support each other, whether it's through church or through scouting activities and youth groups, or whether it is through local community groups. There are ways to have small groups of people who only see each other and who can look out for each other to make sure that they're okay. So there are simple things that we can do to get through this winter successfully. I would love to see international cooperation as well around both public health measures, ranging from testing through quarantining procedures, through vaccine distribution. Of course, as you and I have discussed before, the United States is currently pulling out of the WHO, but I am hopeful that we will see increased international collaboration in the future.
Well, there's a lot of questions in front of us. I really hope we could use our utmost efforts together in order to solve at least some of them. Thank you so much for your expertise, Dr. Megan Rani, Dr. Alice King-Kyang-Tan, and Dr. Xi Chen. Really appreciate it. Be well and be safe. Thank you.